Good day, I am Stephanie Lee, a second-year nursing student from J.H. Cirillia State College, Pagadian. For today, I am going to do the preparation and administration of ORESOL. By definition, oral rehydration solution or ORESOL is a solution taken by mouth to replace fluids and some electrolytes lost during diarrhea or other conditions that cause rapid fluid loss. Now, there are 6 purposes of this procedure. 1. To replace the lost fluids during diarrhea or other illnesses that cause rapid fluid loss through the oral routes. 2. To introduce salt back into the body to prevent further damage from dehydration. 3. To introduce sugar into the body to improve the intestinal absorption of salt. 4. To reduce the need for unscheduled intravenous therapy. 5. To reduce stool volume. And lastly, to reduce vomiting. This procedure is indicated for the treatment of dehydration in patients, both children and adults. It is contraindicated for patients with glucose tolerance disorder, acute renal impairment, ileus paralysis, and perforation of the intestines. It has a special consideration. For severe signs of dehydration, transport and refer the patient to the hospital immediately to rehydrate through IV routes. So the following are some equipment that you will need for this procedure. 1 sachet of ORESOL, a half teaspoon of rock salt, 6 teaspoons of sugar, a liter of distilled water available, a stirring rod or a ladle, a clean container, a knife or a flat object if applicable, and a clean calibrated glass. Before proceeding to the preparation, first assess the extent of the client's dehydration because the amount of the oral rehydration solution needed for the patients with mild, moderate, and severe dehydration differs. The next is to weigh the client because the amount of ORESOL depends on the client's weight. In preparation for the procedure, wash your hands to prevent or avoid transmissions of microorganisms. To prepare the ORESOL solution, first, using the pre-pack ORESOL, dissolve 1 sachet of pre-pack ORESOL in 250 ml of sterilized water or distilled water in a glass. You may use the most sterile water available because using safe water ensures that it is not contaminated. Then, with a spoon, let us stir thoroughly. Stirring thoroughly makes sure that the contents are mixed well with the water. Now, for the preparation of ORESOL by producing a homemade oral rehydration solution, first, pour a liter of sterilized or distilled water into the clean container. Next, add half a teaspoon of salt into the water. The salt we will use must be in an appropriate measurement because salt is used to replenish the lost electrolytes and nutrients, so too much salt can harm the body. Then, take 6 teaspoons of sugar leveled by knife or any flat objects for measurement accuracy. Then, add the sugar into the water. Then stir the mixture. Then you can also make a mixture of 1 glass, which is 240 ml, by adding a pinch of salt and 2 teaspoons of sugar only. These measurements are only intended for single use. Now next is to administer or teach the mother to give this solution to the patient. Now, the amount of aerosol needed for patients also depends on how much they weigh. It is important to educate the mother or the support person for optimum efficacy of the solution. Give 50 ml of aerosol per kilogram of body weight to mild dehydration in 4 to 6 hours. Give 75 ml of aerosol per kilogram of body weight for moderate dehydration in 4 to 6 hours. And for severe dehydration, give 100 ml of aerosol per kilogram of body weight in 4 to 6 hours, except for coma. This is because the amount of solution increases as the patient's dehydration becomes more severe to work to replenish the fluid and electrolytes that have been lost. Now, once you are done with the preparation and administration of the aerosol, what you're going to do next is to assess the patient's hydration status every 4 hours. This is to evaluate if the aerosol is working well for the patient and to address any abnormal progress of the patient's condition and if the patient need to go to the hospital. Give him or her oral fluids on the way if she or he is conscious. This is to ensure the patient is still being rehydrated and for the continuity of care. Lastly, use the prepared solution within 24 hours only and discard the remaining solution because the solution is no longer an effective remedy for dehydration after 24 hours. That would be all for the preparation and administration of ORESOL. Again, this is Stephanie Lee from JH State College, Pagadian, and thank you for watching.